Hi, everyone. Thanks so much for being here. I know it's hard to pull a couple of hours out of your week, and particularly when the weather's crummy. And I know there are people here whose dogs are at home that aren't necessarily loving the storm. So, yeah, I really appreciate your time. Just out of interest, who's been to one or more of these talks so far? Yeah, amazing. Oh, who's been to two of them? Yeah, cool. So I guess this is the third of the series, knowing that we're going back to the second one on Sunday. So if you missed it, come and check it out. They're not really in order, but who thinks their dog does something that they don't necessarily like because it doesn't feel good? The dog doesn't feel good. Yeah, I do. Sorry, I might have asked that question really poorly. That's essentially what this is trying to say in too many words. Is tonight's about the behaviours that we don't necessarily find desirable in our dogs, but that I think are coming from a place of them not feeling good either. The barking one, obviously about barking, but also more focusing on behaviours that I think are pretty normal and pretty healthy and coming from a happy dog that we don't necessarily like. So equally important, but very different in the way that I think we assess them and then address them. Poor Andrew. This is Andrew. This is Eleanor. These are my hounds. Andrew, I'm told, got a little bit of a hiding in the first talk, so I'm sorry, Andy. It's Andy when he's a good boy. Really briefly, that's me. That's Andrew and Eleanor again. It's a photo of a photo. I'm a vet. I went to vet school. I've been down the coast since 2007 in small animal medicine. When I got sick of working for a corporate, we opened the Vet Collective, which is a low-stress, fear-free veterinary practice where we do all of the normal veterinary things, but also try not to create emotional trauma in the process. The Vet Behaviour Clinic is our behavioural consultancy where I do this stuff. I'm a member of the Australian College, so that they certify specialisation within Australia. I'm a resident in the American College, who certifies specialisation in the US. I'm Fear-Free certified. So Fear-Free is an American organisation who work... Sorry, I'm rambling. I'm trying to get to the good bits at the end. We missed some Q&A and people were upset, so we're going to get to Q&A tonight. Fear-Free promote low-stress handling in animals, be that through veterinarians, vet nurses, trainers, groomers. So they're really cool, and they have there's a website called Fear-Free Happy Homes, which is a really cool website to check out if you're looking for this stuff. And I'm a member of the Pet Professionals Guild of Australia, again, who certify professionals in Australia that are using force-free and low-stress techniques. So if you're looking for someone like that, check them out. This is what we're here for. Again, thanks to the city for having me on board for these sessions. Our goals are, we did some body language stuff. We're talking about behaviour. I think if we can understand them better, we can better serve our pets, keep them safe, keep us safe, because they're in a bit of trouble if we're not around for them, and how to manage some behavioural issues. So tonight we're going to talk there. And also tonight we're going to talk a little bit about wildlife. So part of the reason for these talks is that over the last few years, the number of bites that are being reported to the city aren't going down. They're staying kind of static, and that's kind of not good enough. Subsequently, the state government has has written some new legislation and increased some fines. So here are some numbers. Wandering at large means your dog gets out. Not under effective control means it's out with you, but it's not on a lead, or it's off lead and not under control. And then they go up from there. Attacks a dog, attacks a human. There's some pretty significant penalties there. Needless to say, keep them contained at home. Make sure the fence is good, make sure the gate's locked, keep them on a lead. And if you're going to go off lead, make sure you're in an off lead area, step one, and that you've got recall. I think this graphic is interesting. This is from the city, that of the bites reported to them, I think that's a skewing factor, but of the bites reported to council, a huge majority were not under effective control, meaning owner was there and the dog either was off lead or just not under their control, or had escaped and was loose. So, it just astounds me that this many bites are happening with an owner present. Noise nuisance, another thing that the council deal too much with. Neighbours complaining about neighbours' dogs. So new legislation, this penalty's gone up also. But what does a noise nuisance mean? It means one of the city authorised officers comes out and basically says that your dog is barking and interfering with the peace and comfort of others. They sit there for a period of time, they take some measurements. The rest is history. That's a cute staffy, huh? Isn't that great? I want a blue staffy now. Oh, no, I take it back. Okay. Koala management. So I think this is super important, right? We all love koalas. Again, there's new legislation. So looking at this map, which is in your notes, and you can scan this QR code to check the map out in more detail. If you're in one of these purple areas, you're now in a koala something area, koala designated area. And that means you need to do some specific things. So you need to have fencing that is either koala exclusion or koala friendly. Beyond this, we've all got to do our part. We've got to keep, when we're in potential koala areas, keep our dogs on leads. If we see a koala, put them on lead and report that koala to the city. But speaking of fencing, we've got some images here, including some cute photos of koalas. So koala friendly means that if they get in, they can get out. So they can climb. If it's colour bond, we're providing something that's timber and climbable again here, so that if they're in your yard, they can get out. Koala exclusion, meaning that they ideally can't get in. You'll recognise this image in the middle at the bottom. That's what the city has all around the place. There's a wire fence with a metal strip along the top so that the koalas can't get over it. That above and beyond that, if you live on acreage property, there is requirement that your dogs are not at large on the acreage. You'll need to check the specific legislation, but so that's the reason for the images of crates and kennels. All right, so what are we talking about tonight? I want to talk about what is a behaviour. So I know we're thinking, oh, it's barking, it's biting, it's reactivity, it's lunging on a leash. But where does it come from? So why does one dog bark? Why does the next dog bark? What drives that behaviour? What makes us think that that might be normal? So I was talking about in that barking presentation, this might appear normal, but we don't like it. What makes it normal? What makes one unhealthy? I'm kind of trying to say unhealthy rather than abnormal, because I don't feel like it's my place to say that what a dog does is abnormal. I feel like that's their decision. But most of all, how do we change their behaviour? So how do we best go about assessing what's going on there and changing it? So what's science without a definition, right? I think a behaviour is the outward expression of motivation, emotion, and arousal, emotional arousal. And it's influenced by an animal's genetics, their environment, so that's the world around them, but also the world inside them, and their previous learning or learning history. So we're going to dive as quickly as possible into each of those 7 parts, because I want, hopefully by the end of this, you to think about some of these things the way I do, where you see a behaviour and you think, oh, why are you doing that? What's your motivation? Emotional state, are you doing that because you feel a certain way? Arousal, are you doing that because you have intense emotional arousal and the emotional parts of your brain are screaming so loud that the logical parts of your brain just can't speak up and be heard? So when I'm yelling at you and you just can't do the things that you would normally do, that might be why. And then genetics, am I asking my working line fox terrier not to chase the possums along the fence when we've just bred that dog for the last 300 years to chase small furry critters? Environments, what around them is triggering things. We're going to talk today about what inside them is triggering things. I see cases where they turn up because of a behaviour, because that animal is doing something externally. They're trying to make a change in the environment, but when we dive into this, it's because of something that's happening internally. And then last of all, learning. Like us, our pets are constantly learning from what's happening around them, and that can sometimes mean that they learn to do things that we don't want them to do. they can learn that that actually achieves the goal they're chasing. So what do I mean by unhealthy? And here's is where I give Andy a break and I introduce Jamu. So Jamu was my golden retriever cross Maremma, who my wife, who is also a vet, brought home from the emergency department. Jamie had decided to escape the backyard of his previous owners during a storm, and so we don't know whether it was thunder or separation anxiety, because he ended up with both. While he was digging under the fence, he got stuck and the neighbour's two rotties chewed on his face. So he got to emergency and the lovely owners looked after him. They did what they needed to do. And at the end, they said, hey, listen, we just think he's more dog than we can kind of look after. And Dana, being a softie, sort of thought, oh, look at him. I mean, he's adorable. We'll find him a home. And then, famous last words, right? Foster fail. Vets. Also, he came home and pretty rapidly we realised what was going on inside that head, and I would have felt pretty guilty offloading him to one of my friends. And I probably would have got some pretty dirty phone calls about it. This is a photo of him inside our house post-thunderstorm. What some of you may or may not have seen is the top of the hole he's chewed between the living room and the garage. So that hole extends to the floor and widens to the distance between two timber structures, big enough that he could go through, and subsequently him and the two other dogs in the house then feasted on kitty truffles for like the next 2 weeks before I plastered that up. But yeah, he taught me a lot about what is unhealthy. I sometimes think about this as problematic behaviour, like, hey, that's a behaviour and it's a problem for me, versus a behavioural problem, in their general behavioural health. Truly, it's just a wording thing, but that works for my brain. What I'm talking about here is normal, abnormal, versus desirable or undesirable. I'm talking about the stuff that's no good for them as well as no good for us. When I think about this, I'm thinking on a species level, what is typical for a dog to do versus, potentially species inappropriate. It's hard to know because should a dog be inside a house dealing with drywall during a thunderstorm? It's a little bit of a abnormal environment for him, but maladaptive. So I think about adaptive as a term to explain that a behaviour should make an animal's life easier moving forward. It should make sense. It should make their life easier. It should make them, they should gain something in the moment. And I certainly don't think for Jam, chewing a hole through from the living room into the garage made life a whole lot better. Disproportional to context is one thing I think about. I gave an example on Sunday. Aggression can be normal, it can be abnormal or maladaptive, but it should slide on what's often referred to as the ladder of aggression. So aggression has varying intensities. It can start with, a tiny little snarl that, if you're a dog and you read body language really well, that might mean enough. And you're like, whoa, cool, copy, I hear you, I'll leave you be. Can turn into a little growl, can turn into some more teeth and a bigger growl. It can turn into a bit of a bark, get stiff and you start staring them down and really mean it. And then you get up and you get big. And so all of these things should scale. And as the pressure comes off, they should scale back down. So for instance, I'll use an analogy that's all too familiar in the veterinary world is I walk into a consult room and there's a dog sitting, let's say typically under their owner's legs, right? Who's been there at the vet, whoop, dog's under your chair. I walk in and the dog goes, oh crap, here he comes. Here's another one of these guys. So first of all, might get a bit tight and kind of not want to look at me, just like, I'm just going to look into the corner of the room and pretend this guy's not here and surely he'll go away. I keep walking across, I get a bit of that whale eye. You see all the whites of the eyes happening, bit of a snarl, bit of a growl. I keep coming and eventually, if I'm being a moron, out they come, snappy dragon. And, some people say, wow, where did that come from? But there's a whole lot of body language trying to communicate that. What should happen though is as I back up, let's say I don't get to the point where he's jumping across the room at me. If I back up, that should scale back down. And she'd get back to the point where, there's a little growl, and then back here, and then back, and eventually to the point where we're more comfortable as I came in. So that behaviours should scale proportional to the trigger. Thunder or storm phobia by definition, is a fear that's disproportionate. So Jem could have had a thunderclap overhead that rattled the house, and he would have done this. There could have been the tiniest little rumble from Pimpamar, and he would have done this because he was phobic. And all it took was that tiny little awareness of the trigger, and it was disproportionate. Again, that kind of moves into illogical motivation. So what's his motivation in that moment? And now, I don't know, I can't ask him, what were you trying to do? Maybe he was trying to get away and he didn't realise that the thunder would be in the garage as well as in the living room. But yeah, sometimes there are things that clearly are not very logical. All right, now to dive through those 7 kind of factors that play into a behaviour. What's driving a behaviour? Motivation. So these are the things. What is a dog trying to get, keep, or get rid of from a behaviour? So I'm thinking, they want to obtain desirable resources. That might be food, water, shelter. It might be a friend. It might be a sexual partner if they're entire. Then they want to hang on to those things. We all know about the dog that resource guards. It gets a bone for the first time in its life and it's happy as Larry in the backyard, and then someone wanders over and it does what I just described. And then sometimes they want to get rid of things. So their motivation might be to get another individual to move away and say, hey, you're not my friend. I'd like you further away from me right now. We're not pals. So motivation is about, what are we actually trying to do here? Emotions. We're going to spend a bit of time on this today, particularly when we get to the behaviour modification section, because emotion is something we can do a lot with. We can train in behaviour modification. We can change their emotional state, and we can condition positive emotional states in association with specific stimuli. Lots of words here. Pretty picture. I like looking at this with emojis. Generally, I think emojis are annoying and they make communication really vague, but I thought this was kind of funny and cute. There's a lot of different emotional models. So if you look at psychology, particularly in the human literature, there's lots of different people looking at the gamut of emotions in different ways. What I want for today is essentially to come down to this concept of thinking positive and negative valence. Is this behaviour today coming because my dog feels good or bad? And then beyond that, the common negative behaviours that we deal with: fear, anxiety, frustration, pain. There are more, no doubt, but they're the common ones. When I think fear, I'm thinking about an emotional response to a perceived threat. That thing is there in front of me. So I'm walking to cross the road and a car comes through, cuts right in front of me and almost takes my toes off. That's a fear response. The car is there, it's a real threat. The next day when I come back and I look 6 times before I cross the road when the car is not there, that's anxiety. That's anticipation of a potential threat, of a future threat. And I think we can distinguish those things in our dogs because I think we see both of them and they're different and we can approach them somewhat differently. Frustration, I think, gets underrated. Frustration is a thwarted attempt to achieve a goal. So you're not getting a desirable outcome. And frustration is an emotion that's made to drive us harder to work towards the goal that just got thwarted. So I think there's a lot of arousal in there. But imagine if you were living in a world where you were always confined either in a room or a yard, and when you were free of that room or yard, you were tied to something. Sounds like our dogs' lives. Sounds like my dog's lives. I'm not saying anyone's doing anything wrong. It also sounds like prison, right? I'm in my cell. I get let out in the yard. Yeah, it's big and there's the sun and it's fenced, but I'm still fenced in. And then if I get out of there, I'm hopping on a bus and I'm like tied up to myself or to someone. So it would be frustrating not to have that choice. And so I know this gets a bit down, right? I sound like a complete downer. I don't want this to be about getting down. What I want us to think of is, how often must our dogs get frustrated? I know Andy, and I'm not going to pick on him. I'm just going to use him as an example. He's safe here. We're walking along and there's a dead, noisy miner in the gutter. And now Andy is a working English Cocker Spaniel. He lives to chase birds. He'll happily chase a dead bird into the gutter. That's the best part of his day, is to find that bird in the gutter. And if I catch him 1 foot short of that thing and say, "That's fucking disgusting, get out of," how frustrating is that, right? Am I going to do that? Quite probably. Do I want him to eat the roadkill? Probably not. Like, I don't want to take him to work because he's got gastro. But that would be super frustrating. That's like the best part of my day. And you just cut me like short. So I just want to think about frustration. And we'll get to some case studies later that I'll bring that up. And then pain. Pain is emotion and physical. So it's psychological and physical. And I want everyone to know, to think of that. You already know it. Think about when you've had a headache for a week and you get home from a day of work and someone says, "You forgot to take the bins out. It was bin day today." Whereas, if that conversation had have happened at the beginning of the day, it might have been, well, it would have saved the bin day, right? No, it would be a different thing. Chronic pain changes our psychology and our emotions. It is an emotion. I mention all of this because when we get to behavior modification in the, but what the hell do we do? We can condition positive emotions in association with the things that are triggering the behaviors we don't like. Arousal. So I think of emotion and arousal slightly differently. Like, emotion is that valence, and sometimes I think of the arousal as the volume. So if emotion is the type of emotion is the genre of music, the arousal is the volume. And the main point here, whether I tease country music or not, is that good or bad music, too loud is too loud, right? So you can be feeling good, you can have a good day, and if you have too much energy with it, for us, they call that mania. And it's a condition. And I think the same thing happens in our dogs. I think we have things that are too exciting, too arousing, and I think we have lots of animals that really struggle with that level of arousal, including Andrew. And I think we can do stuff about it. And so in one specific part of this BMod talk, behavior modification, you call it BMod if you want to be a cool dog trainer, I'm going to talk about how we can condition relaxation to specifically regulate arousal. Genetics. Species, we can't change that. We probably don't want to. Dogs are cool, right? Breed group, we can't change that. Probably don't want to. You probably picked your border collie or your spoodle or your pug or whatever. There's probably no pug owners here, right? Pugs are great. They're not causing any trouble. We got a pug owner? No, I know pug owners, but they're not here. But I think, so breed and group, I think it's important for us to recognize, like I mentioned before about the fox terrier, we've spent a fair bit of time deliberately selecting them for how they look, but also what they do. And I think that matters. I think there's clinical research that looks at this, and partly some of it says, hey, it's not that big a deal. There's as much diversity behaviorally within a breed as there is between the breeds. But I know there are dogs that know who they are, right? Someone in here has a border collie that knows it's a border collie, right? Yeah, exactly, right? And someone has a terrier that knows it's a terrier. And the lucky person that's probably not here has a cavoodle that knows it's a cavoodle, right? Because it's sitting at home on their lap watching TV. I really like cavoodles. I've never had a little dog, but I really like them. And so I think breed, and if not breed, group matters. And we just think about that, right? We throw that in the mix and we go, cool, we're not going to work on this, we're going to work with this. Then I think individual, same vibe. What do we know about mum? What do we know about dad? Absolutely, that impacts our dogs, like it does us. That's where their genetic code comes from, and that makes a big difference. Again, we work with it. Epigenetics is what we can work on. So epigenetics is how we express the code. And I accidentally came up with the analogy on Sunday that genetics and the transcription of genetics is kind of like a choose your own adventure book, in that we've all got a genetic code, which is the book, but we get to decide, or we decide epigenetically what parts of that genome get read. So we can skip the chapter on X or Y. And so the environment actually shifts this epigenetic transcription, so we can make a difference here. One really good example, and I say this not for practicality because I don't think too many of you are breeders, but we know that if mum is super stressed while she has pups in utero, those dogs come out with increased anxiety. So even if mum is not an anxious individual, if she's got elevated cortisol during pregnancy, those pups come out and their amygdala is bigger than the previous litter. And it's an amazing evolutionary adaptation, because those dogs come out, they go, well, if mum's been stressed for the last couple of weeks, the world must be pretty scary at the moment, so I'm going to come out ready for it. But what does that mean for all of us whose dogs have, potentially not come from the world's best place? Or what if mum ended up in a shelter and we've gone and done that great thing where we adopt a shelter dog, but these pups were born in a shelter environment? So those dogs come out ready to go in terms of anxiety. So that's an example of epigenetics, but that continues. So the transcription of that genetic code continues, and it can vary. Internal environment. This is something that floats my boat as a vet, because it's something that I think often gets missed when our dogs start behaving in a way, particularly an older, like an adult dog, and starts doing something different, and we think, I know, I'm just going to yell at you about it, right? But why is my 8-year-old perfect Labrador just started yelling at the fence? I wonder if something's gone on inside. So we know absolutely that, cognitive and emotional health matter. So cognitive health, I'm thinking like cognitive decline. Dogs are one of the really, really solid models of human Alzheimer's. So they get these same cellular and chemical changes within their brain that lead to cognitive changes. Emotionally, we know that they can, over time, learn negative assertions. They can have trauma like we do. So things are then conditioned to be scary. Physiological. This I'm talking about is like hormonal disease processes. And I used an example the other day of a dog that develops diabetes. So we all know that we've heard of diabetes. So in diabetes, we develop insulin resistance, and we're not getting enough glucose into our cells. The trigger then goes, hey, eat more, because we need more glucose. So all of a sudden, we've got a dog whose food drive elevates. And the analogy I used was, what if I've got my perfect Labrador, who's always been the fat, food-driven one. It's a Labrador. And then I've got my little fox terrier who doesn't really care about food, because at dinner time he wants to chase the possums along the fence line, right? Like we were just talking about. But now he's got diabetes and he's really hungry. Maybe he's even got diabetic cataracts. So he can't see the possums anymore, and he's really interested in dinner time. So where the Labrador used to push him off his food bowl, and he went, yeah, whatever, man, I'm going in the backyard to see what's happening. He's like, oh, I'll fight you for dinner. And then we have a change. So then the resource becomes more valuable because his hunger's gone up. All this to say physiology matters. There are lots of disease processes that can manifest in behavioral outcomes. So if things change, think about medical health as well. Physical. Anything physical can change behavior, but the three that I see time and time again are pain, particularly in dogs. Osteoarthritis, it's really common. They all end up with it, hopefully, if they get old enough. I don't wish osteoarthritis on dogs. I just hope they get old. Dental disease is another really good one, and it's really well hidden. Often we don't look in there, right? And so their mouths can be pretty average and they can be pretty painful, loose teeth, broken teeth. That would make us pretty grumpy. I think people use tooth pain as an analogy for why they're grumpy. So pain, itch. I sat on a great lecture from a human dermatologist that talked about the fact that in human dermatology, as he practices, if you've been itchy for 6 weeks, they start to think about putting you on an antidepressant because being itchy for 6 weeks really, really sucks. And I mean, I have patients that have been itchy for 6 years. And so I have no doubt that that makes you grumpy. And GI upsets, again, it's no fun. We've all been there. But when it's chronic, it can really upset the apple cart. From internal environment to external. So of course their world matters, right? What's out there, the things they smell, the things they see, the things they hear. Smell we probably don't understand, but sight and sound we can get some idea of. There are probably things that there are definitely things we're not going to hear, but I think we've got some understanding. I think for a lot of our dogs with behavioral concerns, there are going to be specific stimuli that trigger these behaviors, and they may be any of these or combinations of them. A lot of the questions that come through, I talked to a lady on the weekend talking about her dog now reacting really aggressively to the TV. And so straight away I think, cool, I don't have to think about smell yet. Our TVs don't do that. But I got sight and sound, and I don't know which one it is, but I'm going to assume it's both and find out, and then work on them separately, right? But so the external environment matters. Not only does it potentially trigger the behavior, but it also sets up for it. And I'm sure someone here has the dog where, we're walking along, dog might be leash reactive in some regard. We're walking along and everything's fine until we get to that place. And that dog knows contextually that when we get to this street, there's a dog there and there's a dog there and there's a dog there. And that environment cues what's about to happen next. And even if it doesn't happen, even if that dog's on holidays, we're still like, here it comes. The environment really matters. And last on that list is prior learning or history, what I often call learning history. So what are they thinking? What are they feeling? What worked last time and what didn't work last time? And so I think when I look up here and I think reinforcement, I'm not necessarily saying your dog barks at the postman and you run out there with a schmacko and tell him, hey, good boy, yeah, that's reinforcement. But what if he thinks the postie is super scary because he's dressed in high-vis and looks like a weirdo, and now instead of riding a motorbike, he's on like this electric trike from the future, and he thinks, hey, you're scary, get lost. And what happens every day? He tells the guy to get lost and he keeps on going. Reinforcement, right? That's negative reinforcement. It works every time. Punishment. While punishment will suppress a behavior, it may also condition for that individual that a negative emotion associated with that event. And so conditioned emotional responses, while in the behavior mod section, we're going to talk about trying to condition positive emotional responses, we can condition negative emotional responses accidentally. So learning history really matters. All right, that's that list. They're the things that feed into creating a behavior. And then you think, yeah, righto, shut up. Now treat the thing. And so in the barking talk, I put barking, but I like the analogy of scratching here, because I think lots of people here will have taken their dog to the vet because it's scratching. But generally we don't treat scratching, right? What do we treat? How do I stop a dog scratching? Treat the cause, exactly. Stop it being itchy. If it's not itchy, it's not going to scratch. What about those of you that have taken the dog to the vet because it's limping? We don't go, oh, listen, well, I'm just going to put a splint on your leg and tie it to the other one, and then you can just hop on both of them together. We don't treat limping, we treat the lameness or the pain. And I want you to think the same thing about these behaviors. I don't want you to think, how do I treat barking? I want you to think, what are the things, barking's the behavior, what are the things that are leading into that behavior, and how do I treat them? Right? Is my dog potentially scared of the postie? How do I dive into that? Rather than saying, don't bark. He's like, why? I've got good reason to bark. So assessment. This is quickly how I think of those 7 things. Context, that's the environment. Emotion, as we talked about, is that positive, negative valence and arousal. And then motivation, what are they trying to get here? What are they trying to get away from? Traits are thinking more about internal things and the genetics. So what's our plan? When I'm looking at changing behavior, I'm thinking about these things. And now sometimes I'll scrub that. Well, sometimes we get rid of that top one pretty quickly. You know, 12-month-old dog comes into me looking beautiful, chasing the postman. I'm like, cool, you look $1 million, you're off my list. But I want to think about it. I want to particularly think about it when behavior changes and we haven't seen something happen in the environment to explain it, and we don't think anything's happened up here to explain it. And by that I mean, haven't become a teenager, haven't just gone through social maturity to become an adult. There's been no developmental change. There's been no traumatic experience. I don't understand why this behavior has changed. Let's make sure we're ruling out any physical health stuff here. Are you sore? Are you itchy? Are your guts okay? Let's just check that out. Environmental management, and we're going to dive into each of these one at a time. How can we manage that dog's world, the outside world, to change both, hopefully remove some triggers that make them feel crappy and might make them do the things we don't like, but also to change those antecedent arrangements. So that context, right, where I said, sometimes even if the trigger's not there, the environment in which those triggers have presented previously can be enough. So what can we do to the world? Then behavior modification. What can I teach that dog to either do or feel in that instance that's going to make a lasting effect on that behavior? And then medication. I know we're here to talk about behavior, and I'm not going to talk too much about medication, but at the end, I'm just going to clarify some of the things that commonly get asked of me, or, some of the reasons people are really worried about medication. And so kind of just to say, what can they do? What can't they do? What do I want them to do? So, physiological, physical disease, that's that top one. And I've already been through this, so I'm not going to harp on. But just remember that physical changes can manifest as behavior. Environmental management. My goal here is to change the world around our pet in a way that prevents further sensitization. So sensitization is increasing that reaction. So pushing that animal past its coping threshold to the point, for instance, the vet clinic. Vets are really good at sensitization, unfortunately. Past the point where it feels the need to protect itself, potentially causing trauma, resulting in rehearsal, which strengthens neural circuits and potentially results in accidental reinforcement. And I didn't mean to use that analogy, but I walk across the room ignorantly, closer and closer to your dog, hiding under your chair, talking to you, having a great time, talking about the football that just happened, not thinking about your dog. I'm not protecting them. I'm causing sensitization because now they're over threshold and they don't feel safe. That feels traumatic. And then in terms of rehearsal, I'm thinking of 2 things. When that dog then defends itself and jumps out and barks and snaps and whatever it does, on a neural level, anytime we fire a circuit, it gets stronger. An amazing analogy that I heard a neurologist give is that neural pathways are like walking tracks in the bush. And initially, they're like bush. There is no track. It's like you look off the side and there's just scrub. And then it fires once and it's like one person's walked through there. And you can kind of make out, yeah, they've pushed that thing out of the way and I can see one step and that's snapped. But after the time 100 people have been through there, you're like, yeah, there's a path. And after 1,000, there's this nice dirt track and you can kind of jog along there. Neural pathways are the same. So the more they fire, the cleaner and stronger those pathways get and the more likely they are to fire again. Then I'm thinking, on a separate level, I'm thinking reinforcement. And again, this doesn't need to be, good job, Fido. You just jumped up and tried to bite the vet. Here's a schmacko. If Fido's prerogative was to not get a thermometer up the butt, and he just lunged across the room at me and he's 50 kilos, he just got what he wanted, right? I'm hightailing out of there. I'm tucking my tail. So that's reinforcing, right? He goes, last time I came here, I tried to be super polite. I communicated with body language and I hid in the corner and then they drugged me out and I like froze up and hoped that it'd go away. And here came the thermometer. That didn't work. So I tried something different today and it was reinforced. That's what I'm thinking with management. And we'll get into these. We'll run through these in some cases so that you get an idea of how that actually looks on a practical level. I think when I'm thinking management, I'm thinking two layers. One on a protective front, I'm thinking, how do I aim for zero triggering events? What I've heard people call a cortisol holiday. You know, if I'm petrified of the postman, and I'm going to keep harping on the postman, if I'm really truly scared of him and every day he comes along, that's a traumatic event every day, and that's strengthening my resolve that that is scary. When we get truly stressed and our cortisol levels go up, our ability to lay down functional memory in the higher parts of our brain disappears. And the only memory that we can actually consolidate is in the amygdala. And those memories are about fear, what is scary. So then when new sensory information comes in, it gets funneled through to the amygdala. And the question is, hey, is this a threat? It gets there really quick. It's this lightning fast, hey, do I need to react on this right now? And then slowly the information trickles up here for like a logical, thoughtful response. And so if we're stressed enough, we're only going to lay down those fearful memories. So I'm trying to protect that individual and get to zero triggering events for a period of time. The other layer to management is then when we're ready to do some behavior mod and work on this problem and try to fix it, I then want to create an exposure, so not zero triggers, but I want to be able to expose that individual, the learner, to the trigger at a level that's below their threshold so that they can cope and they can engage with me and they can think and they can learn and subsequently they can progress. But managing that threshold, managing the intensity of that trigger gradient is one of the most important things. And it's somewhere where I think people get unstuck time and time again. I get a phone call, I get an email. Yeah, my dog's reactive on lead. And I've been exposing him to dog after dog after dog. And just every time he does it, he's not getting better. Yeah, because we're doing the same thing. He's going over threshold. We're engaging those fear-based circuits, and we're actually consolidating for him the concept that this is scary and what I'm doing is what I need to do. What we need to do is manage, hey, how can I expose you without pushing you there, talk you through it, teach you something new to do, have him do it, reinforce it, move on and progress. And again, that will be in one of the case studies, but management's really important. Here is, probably should have clicked the button. Here is, I think this slide is not in your notes, and I apologize, I slipped it in after we printed them. This is an image from Lily Chin, who is an amazing illustrator from the US. This is talking about what's often called the traffic light system, and it's talking about levels of arousal trigger gradients, and that point at which this dotted yellow line, we're going to turn from the dog that's not reacting to the dog that is reacting. So down here in green, we're cool, calm, collected. Then slowly we get up, we're in that low yellow, below reactivity. So we're alert, we're aware, we're starting to get a little bit keyed up, we know what's going on. Then we go over and we're starting to behave in a way that we as the people on the other end of the lead probably don't like, but it's because we're starting to not feel good. We're in a negative emotional state and our level of arousal is pumping. When we're training, talking about that management of triggers, we want to stay below this line and we probably want to get to the point where we're touching from green to yellow. Because I mentioned about memory consolidation. We're not really learning much when we're asleep. So we want some level of arousal, some level of stress. We want them to be alert and aware. They need to know the dog's there if we're going to teach them something about that dog. But they need to be able to stay cool and think. So I thought that chart was cool. Then comes BMOD. Again, behavior modification. And I'm thinking, what do I want to do? So how do I alter behavior? What do I want you to do instead? But today, one of the main things I want to talk about is how do I want you to feel? And that comes into the classical conditioning component. So classical conditioning, which is also known as respondent or Pavlovian, named after Ivan Pavlov. He was doing physiological research. He had German shepherds and he had these scary, crazy little traps that were catching their saliva. I actually don't know what he was studying, but it had to do with saliva, which is kind of gross. And he would ring a bell and he would put down their chow and then he would catch drool. And what he found was, and this was a revelation at the time, is that he could ring the bell, no food present, and they would salivate. So he had paired an involuntary response, salivation, something that the dogs are not in control of. He had paired that with a bell, with a completely random stimulus. And you think, yeah, great, but my dog drools enough. We can do the same thing with emotion. So we can take an emotional response. What we're going to aim for is something positive. We need to find a way to elicit that positive emotional response. Often we use food, but we can use other things. For the border collies out there, you can use a ball. For the staffies that love to play tug, we can play tug. For the dogs that aren't really driven by either of those, sometimes praise, sometimes the right petting, from the right person will help. Functional reinforcers come into this too. Hey, I want to be away from that dog. Cool. Look at me. Yeah, good job. We're going to get away. So reinforcers can come in a lot of shapes and sizes, but what we're going to do is something that makes them feel good every time we pair that with the trigger. Reactive dog, we see a dog, we do something good, we get away. We pair that every time, like Pavlov paired a bell and the food. For him, the saliva came along for the ride. For us, the positive emotion is going to come along for the ride. And eventually we get to the point where the trigger, whatever we're working with, like the other dog, actually elicits that positive emotional response. We'll get into some examples. I want to quickly talk about relaxation though, because I don't think this gets talked about all that often. And I think emotional arousal, maybe not as important as emotional valence, the positive, negative vibe, but I think arousal is really important. And I think it gets missed, and I think we can teach relaxation. Again, here's Jammy. For those of you that didn't see it, this is his handiwork in full flight. And then later, this is him, somewhat pharmaceutically enhanced, relaxing. We transitioned to a point where we would play with toys during thunderstorms, and somehow it eventually became the game where we would stack toys on top of Jammy and he would then roll over and toys would go everywhere. It was kind of fun. So we got this guy when he was 4. We had him for 11 years. We lost him as an old man, despite all of his interesting behavioral things. Relaxation. The relax down is something that I came across thanks to my mentor, Dr. Chris Parkle, who is a veterinary behaviorist in Portland, Oregon. I think if you're looking at your notes, I've just shuffled them. So it is there, but It might be out of order. Yeah, apologies. So the relax down is a position, and I've got a couple of videos here that we'll check out straight after this. It's a position that we know influences heart rate, arousal, and focus. So their heart rate, their respiratory rate, their blood pressure come down, their arousal comes down, their focus goes up. Over here in the bottom left corner, we've got a lovely little image of a brain and a seesaw. And I like to think of that limbic system I was talking about, the amygdala, that's in charge of that fear and anxiety-based learning. That's where a lot of this emotional arousal comes from when we're talking negative stuff. And it's in balance against the prefrontal cortex, which was where we're regulating our emotional responses, this executive function that comes top down. And so this gives us the ability to kind of tip that seesaw in the direction that we want. In the middle there at the bottom, it says, what can we use this for? We can use it for all sorts of things. Anything that is arousal, that arousal is playing a role in. Number one, we start by luring them into this posture. And then two, we're keeping them in this posture using some gentle luring. We're teaching them that position. Often we're teaching them a context. So we pick a nice spot. We pick a naturally relaxing spot to start with. And we're coaching this. We're learning it together. We're training. Like if we were going to take up a meditation or a breathing practice, right? Someone said to you, yeah, it'll be good. It'll bring your stress levels down. You don't start that breathing practice in the boardroom at the time of the meeting. You practice it somewhere else first. You're probably better off to do it somewhere nice and chill, and you get good at it. And that's the same thing with these guys. This isn't something that works today. It's something that helps. Well, actually it can, but it helps you way more in a month's time. Intro to mat work. We can then condition a mat. And so that's part of the environmental context, is that they learn, hey, when the mat comes out, we're doing some relaxation stuff. Eventually, we're just capturing softer, calmer, more relaxed. We're using a low tone of voice. We're delivering the food onto the mat. You'll see all this in the videos. We often use low value treats, where a lot of training, we want really high value treats to keep them engaged. This, I want to keep them pretty chill. I don't want them too excited, particularly if they're super food motivated. And you'll see up there the little pin on the wall. Keep the eye contact out because I want it to be relaxing. But I'll throw over, this is Dr. Parkle, my mentor, doing this with a dog named Amos. So I want to say thanks to Amos and his owners for letting me borrow this video, and to Dr. P. Throws a treat away to get him back up. And this is the very beginning. Later on, he won't be talking that much. He won't be being that exciting because he wants Amos to not be excited. He wants him to be chill. I'm going to turn the volume down and show you one of mine. This is me with my friend Possum. This is Possum's first time doing this, but he makes me look good. I won't take the credit. Is that all?
George Strip, yeah. That's I know that version is the same way to one the spin. So you do some.
So just that C sharp and always here. And so this takes me 10 minutes sometimes to get into that.
Well, he already worked. Yeah, he's already got to set his hot layer and the spins exactly the same thing.
And so the upper because it's molded there for, but it didn't think, oh yeah.
Sure.
You also use it to destroy to cut like this. You actually get upset bullshit. Yeah, I got now. Yeah, it's right.
And so the position is sit down and then pop a hip. So I want him on elbows and over on one hip, and I'm using his head to do that.
It took me like 6 months to do the lie down. It was like 3 seconds.
So little things here are that I'm being to the wall because I kind of want this to be less about me and more about just being in space.
I was going to say that.
I don't put him eyeballing me to the tree. Yeah. I'm kind of trying to be quick enough.
He's not doing this.
I screwed that up.
Chat that. Thì their body right side.
If you decide us to draw put me into ladder or my down, I'm cool with them. Yeah, that's some of the car. But yeah, all I want to do is just casual, right?
And so I'm going to keep talking about possum. I just wanted to stop it because that video goes on for a little bit too long. What I noticed seeing that, because I've done it time and time again, is he's getting further and further into the floor. And it's subtle at this point. He's 2 minutes into this learning curve. But what you tend to see is initially they sit, they drop, they're like super eager. You lure them to the position, they pop over, which is a nice casual position. So I don't get every dog to do this in the clinic, right? Some of them can't. Some of them I won't sit on the floor with, right? Some of my patients want to eat my nose, but it's true. But over 2 or 3 minutes, a lot of them you'll see soften, they get heavy, they get floppy, they take a big breath. And then as we do repeat reps, we toss a treat, over they come, flop. And certainly over time, when I get videos back from owners, when I do this with my own dogs, they get more and more relaxed, and you see them get the idea, hey, when dad comes in, pocket full of treats, sits on the floor, this is what they're doing, and they run over and they kind of go, and we can use that. We can use it before something exciting, during something exciting, or after something exciting. And if I want to teach my dog to do something that requires a level head and some focus and not to blow up, whether that's a positive or a negative emotion, this is a really good tool. And Andy is the perfect example. I don't really think I've seen Andy express a negative emotion in his life. This is my Cocker Spaniel, the black dog from the very beginning, for those of you who missed out. He's a super positive dog, but he's super highly aroused all the time. He's like 10 out of 10, 11 out of 10 all the time. And that's not always fun, I don't think, for him. And it's definitely not always fun for this guy. And so if I can turn that volume down before I try to train him in something, it really makes a massive difference. So meds, look, all I want to go over here is when I'm thinking about meds, what am I actually trying to do for that animal? There are meds that can reduce stress, which subsequently increases comfort. They help improve mood, so they can skew them towards that positive mood rather than negative. They can help regulate arousal for those dogs that are experiencing intense emotional arousal. They can push them, like that graphic showed us, that seesaw between those brain regions. They can help push them away from that limbic emotional area into that prefrontal cortical logical thought area. They can also improve sleep, which I think for a lot of our dogs is pretty important. I see a lot of young dogs that aren't sleeping enough. They're intensely excitable. Sometimes it's fear, sometimes it's not, but subsequently they don't do enough sleeping. They should be sleeping a lot. They should be sleeping 15, 16, 17 hours a day. And if they're not, their brain's probably not getting a lot of the nourishment and recovery that it needs. The things I'm not chasing is sedation. A lot of people kind of think, I don't want to talk about drugs because I don't want to just sedate my dog. I don't want to change his personality. Now, know that I think changing personality is essentially not possible except through sedation. But sedation is an unwanted side effect. Anytime if you ever do try a behavioral med, a psychotropic medication, and you see side effect, sedation, that's a side effect. Ring it in. It's the wrong drug or it's the wrong dose. Other side effects that we tend to see, the most common one is belly upset. Like anything we put in their gob can upset their belly. These meds are no different. And occasionally we will see with some of these drugs, opposite to sedation is some of them can be a bit activating. They can feel a little bit jittery. I know some of the antidepressant type drugs, and now I like to quiz any of my friends that take them. I'm like, what are you on? What does that feel like? And I know that at least at the beginning, as their body and their brain is kind of adapting to it, they can feel like they've maybe had a few too many coffees. They can be a little bit jittery and a bit wound up. So just being aware of those things and managing it. But yeah, not here to harp about it. Just want you to know some of the things that they do and don't do. Terminology. When we get to the behavior mod in some of these, I'm going to talk about desensitization. Desensitization, unsurprisingly, is the opposite of the sensitization that we were talking about. It's exposing a dog to its trigger below its trigger threshold so that it learns that there is no need to react, so that it can see the trigger, it can think, it can cope. Counter conditioning is then in that moment teaching something new to do, a different way to feel. And so often we talk about desensitization and counter conditioning together. They go hand in hand. Sensitization, I mentioned. Flooding is the sink or swim approach. Is the dog that doesn't like other dogs and we think, I'm just going to take you to the dog park and chuck you in there and see how you go. And that's called emotional trauma, which happens with flooding. Really occasionally you'll find the dog that's not emotionally uncomfortable and they might be barking because they're the border collie and they like to hurt other dogs, and you throw them in there and things are okay, but it's certainly not a great idea. Habituation is a process that we all experience where our brain tunes out emotional stimuli that it decides are not overly important. And the best example is one I can give you right now, the air conditioning. None of us have been hearing that because it's not important, and our brains recognize that. And if we constantly were aware of all of the sensory input all of the time, we'd all be crazy. And so habituation is a process where our brain goes, that's not important, tune out. And so the same thing happens for us. We've probably been hearing some traffic noise out the back, don't notice it. And ideally that happens for a lot of stuff so we can zoom in on the important stuff. Too often I find we expect our dogs to habituate to the things that worry them, like the other dog, as we walk past. And I think it's a big ask when there's a negative emotion. So if I have a conditioned emotional response that I don't like other dogs, just exposing me to those dogs, I'm not going to habituate. I'm going to flood. That's why I talk about habituation. So, case studies. Number 1, leash reactivity. I think this is the most frequent question that I got. Now, again, this is another illustration from Lily Chin. And the idea of this illustration is to talk about the two different types of conditioning. Operant, meaning, well, in behavior mod, operant conditioning is what we use to teach them what to do. Classical is what we use to teach them how to feel. This graphic is about saying, hey, these two things are always happening and they're always happening together and they're stuck together and we can't do anything about that except be aware of it and use positive reinforcement so they're both going in the right direction. Now in this top left, what we're looking at is a graphic of a dog seeing another dog. The red dog is the stimulus. The dog then barks. And this is saying, we now give the dog that was white and is now grey a treat. And subsequently, and now we'll talk about some of this in a sec. In this hypothetical situation, our grey dog now sees the red dog and thinks, hey, last time I got a snack, and looks to mum to get a snack. I say mum because mums are good at this stuff. And so the concept here is that the dog learned operantly, when I look to mum in this moment, good things happen. And hopefully, in a classical sense, that when I'm with mum and we're around other dogs, good things happen. So we're improving that mood. Now, I see some of the people in the audience who work in the dog training world kind of scratching their head and thinking, yeah, I think there's potential here to reinforce this. And so I think that's possible, right? So I think if we've got a dog that's fairly operant, that's somewhat comfortable, it's thinking and it's saying, I see that dog and I'm going to yell at it and then we're going to go on our merry way. And every time it yells, I give it a snack. I think there's the chance that we can reinforce the barking. What I don't think we can reinforce is negative emotion. If I'm really anxious getting into work for some reason, and as I arrive, one of my crew walk up to me and say, "Here's a cookie." Does that reinforce my anxiety and make me more anxious? Or does that just make me feel good? I don't think we can reinforce that negative emotion. I think we can reinforce the behavior. But so what I'm trying to say here is sometimes we've got to remember these two things are stuck together. So our goal may be, hey, I'm going to use treats, I'm going to make you feel good, and that's going to change this situation. We also just need to be aware that in that moment, we may be reinforcing things. Doesn't mean it's a bad idea. We just need to be aware of it and say, cool, our white/grey dog, what's the outcome? Because truly, this is always a conversation, right? It's not like, oh yeah, here's the textbook, it's black and white, you do this, I do this, you do this, we're done. That's how it happens every time. Every context is different, every individual is different, every dog owner is different. And so this is kind of a question. We go, hey, I know you're not feeling good about that red dog. That's why you lunge like this. Ideally, let's say this rectangular mustard caption, instead of saying you lunge and bark and then I give you a cookie, let's say this is the next time and before you lunge and bark, I give you a cookie. So now the potential is that classically, grey dog is a happy dog because it goes, hey, every time I see that red dog, I get a cookie. This is the best. I actually like that red dog. Thanks for getting me cookies. And on an operant level, we didn't bark, we saw the dog, we got a cookie. So there's no room for reinforcing that behavior. So that is a really good illustration to think about timing, but also management of the environment and the triggers. We want to manage that environment so the behavior doesn't happen, then we can reinforce something different. So that was just me trying to describe the top. The bottom here kind of goes on the same to say, what are we actually reinforcing? It's kind of that same concept of if we wait for them to react and lunge and bark and then we give them the treat, we can potentially reinforce it. Same thing down here. If we're holding hands, which seems nice and romantic, dog pulls their paw away, and then we give them a treat, potentially we're reinforcing them for pulling their hand away, as opposed to this option. But onto more leash reactivity. Going back through what we talked about earlier, all of the things that lead to a behavior, I want to consider 4 different dogs that are leash reactive. I want to think of one painful old Labrador that's got hip dysplasia and gnarly joints and constant pain, and it goes out for a walk, and a young dog comes up and we decide, yeah, we're going to walk them into each other on our leads because that seems appropriate. And the young dog jumps all over the Labrador and it really hurts. And the Labrador ends up snapping and learning that when I interact with other dogs, let's say this happens time and time again, it learns that when I interact on lead with other dogs, it really hurts. That's case 1. Number 2, I have a really excited, I'm going to use a real example. I had a really excited 10, 12-month-old golden retriever puppy. He loved going for walks. It was his favorite part of the day. He loved other dogs. Playing with dogs was his favorite part of the day. He would see another dog and he would pull toward the other dog. Makes sense, right? Checks out. That person got given advice to put a choker chain on that dog, and every time it pulled on the lead to snap its collar, that dog really quickly decided that other dogs were the cause for its neck pain and that it hated dogs. And so every time it would see a dog, truly within the space of a month, with that change, instead of being a big, happy, lovely, fluffy goofball that really did pull that lady around, but really just wanted to get over to say hi, now was like snarling and lunging and snapping because it had been emotionally conditioned that other dogs hurt it. And now that's not the case, but that's what it learned. The third one, I'm going to pick on Dachshunds because I see lots of them and I think lots of them are scared. Here comes a Dachshund. We're walking down the street. We didn't really socialize. Good luck. I hope we're doing okay with the storm. We've never liked other dogs. They're scary. We didn't meet many other dogs during our socialization period. Then we went to the park and I got stood on by a big clumsy German Shepherd. I don't like other dogs. So I'm walking along. I see one coming. I start to tremble. I'm trying to pull the other way, but I'm stuck. I'm tethered to this human anchor that's just going the same way. Here we go. Here comes the other dog. So I'm really fearful. I can't get away. Freezing gets me nowhere. Eventually one day I decide, what if I carry on like a pork chop and I thrash around like a marlin on the end of a fishing line and I snap my teeth and I bark and I growl? Then my mum ran the other way. And as a functional reinforcer, that dog learns, for the first time in my life, you did what I wanted to happen, right? I did all of the polite things. I kind of stopped and I went, no, that's a bad idea. And then I trembled and I shook and I was like, I'm really, really scared. I even tried to drag you the other way, but as opposed to the golden retriever, I'm only 4 kilos. So he's got drug on in, mum in all of her, or dad, I'll blame dad, in all of his dog social ignorance was like, go on, come on, it'll be fun. The dog's like, this is definitely not fun. And then it aggressed one day and it got what it needed. And the last one is frustration. And this, I think, plays back to our golden retriever friend. But we get the dog that has learned it loves playing with other dogs. When it sees other dogs, it gets to play with other dogs. This is the person walking. Every person they see on a walk, they're like, let me run over and say hi. And then one day we think, I don't want to do that anymore because it hurts my shoulder. So I'm just going to stop you saying hi to any dog on a walk. It's like, in a minute. That's pretty annoying because I really like saying hi to other dogs and that's what we've always done. And now you're changing the rules. That's super frustrating. Those dogs can get grumpy too. So we've got 4 dogs that are all leash reactive. One of them's old and painful and crotchety and got hurt by another dog. One of them got punished and got hurt by mum. True story, I'm not making that up. One of them's super scared, has been its whole life. And one of them's really frustrated. If we tried to treat them all the same, we'd be in big trouble, right? They're all leash reactive if we want to write it down on paper. But if we try to approach each of those in the same way, we're not going to get the results that we want. We're not going to be kind to those individuals. So then coming from it from a treatment perspective, I had that slide that said physical health, environmental management, behavior modification. And we're going to leave out behavioral drugs. So physical health really only applies to the first one. Old Labrador, let's get some drugs in there. Let's get some pain relief on board. It might fix the problem. Truly, I see that fix the problem, right? If not, we do that, then we do some management, which we'll get into. We do some training, but with the pain gone, that dog unlearns that playing with other dogs hurts. And so all of a sudden it has some positive interactions and it's like, oh, this isn't so bad. It's like it used to be. Let's roll on with this. The dog that's getting punished on the choker chain, we took off a choker chain and we started doing some management so that it wouldn't pull on a lead. We started teaching it some leash manners. And I say manners because dogs don't know what manners means. But so we taught it what his mum wanted on a walk. So we walked it away from other dogs in a scenario where he naturally wouldn't pull. So we're managing 0 triggers. We're walking around a park, no dogs, and he's delightful. All of a sudden, he's walking next to her like he's about to join the military, and he's getting lots of treats, and he thinks this is delightful. So all of a sudden, he walks beside her. She can reinforce him for it. And then when they do come across another dog, if she decides to, he can have an interaction. And all of a sudden he's like, hey, being on leash around other dogs is fun again. I'm not getting choked. My neck is not being pinched. The fearful dog, I think this is probably the typical, when I think leash reactivity, this is what I think is the typical one. Management, I want to go for 0. I want to stop walking that dog at other dogs because it's scary, it's traumatic. So I want to walk that dog where we won't see other dogs, when we won't see other dogs. If that's impossible, do we need to walk for a little bit? Let's take a holiday. And then I'm thinking about what can we teach that dog? Oh, and then I'm thinking environmental management. How can I set up situations later for training where I can expose to that trigger below that threshold, below that reactivity threshold? So I need to work that out. And we ask that question. For reactivity, it's often as simple as distance. And now it might matter how big that dog is, what color that dog is, how bouncy that dog is, so it might change, but it's still a number. Let's say it's from here to the far wall. Okay, great. Let's set up some interactions where we see those dogs, like our little white grey dog up top. We see that dog, we teach it an attention cue, and we do that at home in the kitchen where I say, hey, little Frank, because Frank's my favorite name for a sausage. If you look at me when I say your name, I'm going to give you a biscuit. And Frank thinks, that's a bloody great idea. So we're walking along and I say, Frank, and he looks. I say, Frank, and he looks. And then we're walking along and we get here to the wall away. Now, mind you, we're outside Frank's reactivity threshold. So he sees that dog and he goes, oh, damn it. There's another dog. I don't like other dogs. But I'm far enough away that I can keep my together and be cool for now. And I say, Frank, and because he's cool, he goes, yeah. I'm like, you're a good boy. Here's your treat for looking at me. Let's get out of here. He goes, that's a really good idea. So Frank just learned a bunch of things. He learned when he's around other dogs, sometimes it's not bad, sometimes it's good. When he looks to me, good things will happen. It's predictable. I will guide him. I'm not the boss. I'm not in charge of him, but I'm going to make good decisions on his behalf. And maybe most importantly, a functional reinforcer, Frank doesn't want to get closer. So when he's the goodest boy and looks, we get further. And if we do that 300 times, I bet Frank likes seeing other dogs. And instead of being this distance, it's this distance, and then this distance, and look, maybe Frank never goes to the dog park, right? But that's okay. Frank doesn't want to go to the dog park, but maybe Frank can pass that other dog on the path and you don't look like that crazy Dachshund person anymore that's got the Marlin, That's desensitizing and counter conditioning, coming at it from this approach where we go, why are you doing this? What do I need to change so that you don't think you need to do this? And then how can I reinforce you for the good stuff? We're going to keep going because I don't want to run out of time. And this keeps coming up and it's kind of topical tonight. So storm phobia. It's a phobia. It's a fear response. It's panic. It's highly emotional. It's highly arousing. I'm going to kind of fast forward a little bit. Management. I don't think we can necessarily get to 0 trigger, right? Unless you own some whiz-bang recording studio, and even then, you probably can't get away from a thunderclap, right? But we can minimize it. So I think about when I had Jammy there looking stoned, covered in toys, not only did he have some good drugs, but we would go into storm mode. Every door and window in the house would get shut. Every blind would get pulled. Every light would get turned on. Every speaker would get turned on. The air conditioning would go on. The fans would go on. I want to alter his environment as much as possible. So if I can block the lightning, I'm doing it. If I can block some of the thunder, I'm doing it. I actually have some patients who do really well in the closet because the closet is small, it's often carpeted, and above them is a whole lot, getting nods here, I've got a whole lot of fabric that absorbs a whole bunch of noise, and it's dark. So I'm reducing the sound, I'm hopefully eliminating the light. I think the environment, I think the atmospheric pressure and the humidity and things can change too. So I like, if we've got it, I'll whack on the air conditioning, I whack the fans on. So that's as best as I think we can manage it. And then I'm going to do whatever I can to try to make that dog feel good. And truly, drugs do come into this. Medication can be a game changer for this stuff. And there are starting to be some meds. So any anxiolytic or fear treating drug could help for this. But there are about to be, I think, some drugs that are labeled, meaning clinically proven, to help with storm phobia, with thunder. Myself and my team at the clinic were involved last summer in a clinical trial run by the FDA in the States, but they had sites out here, and we trialed a drug that seemingly is working really well. Behavior modification, long game. There are some clinical studies that suggest we can use recordings of thunder and we can desensitize them. So we start at volume 1 and we go thunder, treat, thunder, treat, thunder. I keep saying treat. Insert for treat, throw the tennis ball, play tug, pat, whatever makes them feel warm and fuzzy, right? Treats are just the common and easy way to do it. That can work. Those recordings can work for some dogs. They don't work for all. I think a lot of dogs realize the difference. And I think storm phobia is multifaceted, not just noise. I think we can also condition, if we get them comfortable enough with management, plus or minus meds, I think we can condition different things to do. Like for Jammer, we would play games and eventually learned, oh, cool, like when there's a storm, yeah, I'm a bit wide and it's a bit weird, but we kind of have some fun. So that's my quick answer about storms. I want to get to this next one because part of tonight was about the koala legislation. And so I think it's important with wildlife that we talk about prey drive. Now, when I think of prey drive and predatory aggression, I think differently to Frank. Defensive or offensive aggression. So by that I mean Frank backing away and snarling and saying, don't you come over here, mister. Or offensively, kind of on the end of his lead saying, you better get away from me or else. Either of those, based in emotion and arousal, come from parts of the brain that are associated with emotion and arousal. And so when we look at that in a functional MRI, that's what we see. We see those parts of the brain light up. Predatory aggression is very different. It comes from a different part of the brain, and it's not about a big show. If you see dogs displaying aggression towards other dogs, normally it's a big thing. It's like puffing chests and saying, if you come closer or if you don't get away, I'm gonna. Same thing with the postman I was talking about before. They're bouncing up and down the fence line and they're yelling and they're swearing at him. Predatory aggression is normally kind of small, pretty quiet, stealthy, because it's about eating. It's about not going hungry. And if I bounce around and I yell like I do at the postman, who I'm actually telling to go away, if I do that to my next meal, it's going to go away too, and I'm going to be really hungry. So predatory aggression is very different. Not to say that I necessarily think this is predatory aggression. This might just be fun. It kind of looks fun, although not for the duck. I don't think we can stop predatory aggression. I think through selective breeding, we've also bred dogs where their prey drive is shifted. You know, I think herding breeds, potentially that desire to herd and nip and bark is a modification of their prey drive. I think Andy's now drive to, flush birds, so run through scrub and yell at birds and make them fly. I think that's his wacky version of prey drive. All this to say, I don't think we can necessarily get rid of it, but I think we can condition them to do other things. And now talking about this with some of the crew from the council, from the city of Gold Coast, we were talking about operant skills that we can teach our dogs that may help. And so I think, like Frank, an attention cue is really good, because if, like Andy, his drive to chase a bird is super strong, and I know if I come within 10 meters of a bush turkey, I'm toast. And so if I can get his attention and hold it and then go the other way, I don't need to deal with that. So it's a good distraction. I think recall, again, is good. You know, if he's at an off-leash park and I see a bird before he does and his recall's good and I can get him coming back to me, even as soon as he's turned, right, that bird's behind him, it's in the rear view and I'm kind of clear, particularly once he gets to me. I guess the last thing that we talked about is like a leave it cue. And I think we can teach leave it, and I think we need to know before we consider this, we need to kind of realize, what does that mean? What does that mean to us? We can't just kind of run around randomly yelling, leave it, and it means don't do whatever you're doing at this point in time, because that's just punishment. Leave it needs to have a specific meaning. And so for Andy, his leave it cue is really good. In the kitchen for treats. And I haven't taken it much further. But if I throw a treat at him in the kitchen and I say, Andy, leave it, he'll look at the treat, think about it for a second, look at me, and know that he's going to get something better. And if I wanted to do the work, let's say I had a backyard full of cane toads, I think I could get to the point where I conditioned him to see a cane toad, call leave it, look to me, come to me, give him a treat. So I think leave it can be really useful. I think we need to realize, though, that we've got to condition that. And this could be kryptonite, right? Like if that is 200 years of breeding and the best thing on the planet, you better train that really darn well and you better practice all the way up to it. Because Andy in the kitchen, over to here, again, I'm toast. So now I want to skip any more of my case studies and get 15 minutes of questions, because I'd rather do your case studies than mine. I'm going to run through a few. So thanks. And this is my little buddy Ozzy, who we lost last month. But I wanted to put him up there just because I created the slideshow show, so I get to put him up there. But also to say, for all of you that have been writing notes saying, what about cats? I agree, what about cats? But maybe next time. Separation anxiety and time home alone. I've got a bunch of questions, and there's one here that's asking me specifically about puppies and older dogs. So let's break this into 3 chunks. Puppies. And let's say, miraculously, you're asking me this question while your puppy is still within its socialization period. And anyone who saw one of the first talks will know that I'm a little pedantic about what this means. Socialization period is a developmental period that they all go through, and it ends. It's not something we do. There's things that we want to do during it, but it's not a human act. It's a canine developmental period, during which they tend to be somewhat less fearful and somewhat more able to grasp what's normal in the world around them. And that can include being home alone. So if we have the opportunity and we've got a puppy that's still within its socialization period, meaning it's under 14 weeks of age, let's even say 16, let's stretch the friendship, we should be showing them some initially mild and maybe escalating that versions of separation. Going, hey, by the way, at some point in your life, you're going to be home by yourself. Let's give you a little taste of that. Now let's make that as nice as possible. I'll put you in your favorite spot, put on your favorite tunes, I'll leave you something to chew, make sure you've been to the potty so we set up for success. I'm going to go out and I'm going to watch you on the camera or sneak a peek through the window. And if you wig out completely, I'm going to come home because that's trauma and that's not my goal. But if you can tolerate little bits, we're going to build up, and slowly I'm going to show you, hey, listen, little buddy, it's cool. Like, there are going to be times you're home by yourself. You can enjoy it. So that's socialization, right? We can make that part of socialization. It's not all about going to the cafe or the brewery or Bunnings. Some of it can be hands off. Older dogs, let's fast forward that. Let's say we've got a dog that's been fine home alone for the last 13 years and now isn't. I want to know what's happening inside that dog's body. Right? Remember we were talking before and I was saying, do I have a good reason for behavioral change right now? So if that dog was home alone and you got burgled, sure, checks out. That could be traumatic. And that might be why they don't want to be home alone anymore. But if not, I want to go, cool. Have we got some cognitive decline? Have I got a urinary tract infection? Have we got some back pain? Is there something that's conditioned this dog to make it think that being home alone is bad? Now, it might not be that being home alone is the cause, but if when I'm home alone, for instance, I'm not normally allowed on the couch or on the bed, but when I'm home alone, sometimes I'm cheeky and I do it. But my hips are rubbish because I'm 13. And so one day I go and I think, oh yeah, I haven't been up on the bed for a while. I'm going to do it. And so I go to jump on the bed and I experience the most excruciating pain I've ever experienced. And I decided in my doggy wisdom that being home alone hurts. That can happen. So old dog, new behavior, think physical first. Now, middle of the road, Frank, who is also the pin-up boy, I think, for separation anxiety. What can we do? Steps to take regarding separation anxiety. I think management, if it's distressing and traumatic, we don't want to keep doing it any more than we have to. And now I know that sometimes that's impossible, but I think where we can, engaging friends, family, pet sitters, daycare, take them to work, smuggle them in. If we can avoid that truly traumatic, I have patients that will damage their teeth, rip their claws out, damage the home, soil. They're truly panicked and distressed and fearing for their life because they're by themselves. We don't want to do that time and time again because A, that's not a good quality of life, and B, it's sensitizing. So that's the management to start with. Then trying to find that threshold. How can I expose you gradually and make this worth your while, make this a good time? And that's where I think in terms of behavior modification, sometimes training a dog with separation anxiety is difficult because we're not there to condition the positive like I was with Frank. And so one of the tricks I like, and now this is money, but is to buy a remote treat dispenser and set Frank up in his favorite part of the house and teach him that I'm going to approximate leaving. And I say approximate because to start with, if he's going to rip his teeth out, I'm not going to leave, but I'm going to start pretending to. And every time I do, this magical little device is going to spit treats at him. And slowly I walk away down the hall and then I get to the front door and I rattle the front door and I step through the front door and I shut the front door. Then I turn on the car. This stuff takes time. And I know that sometimes you don't want to hear that, but this can be months. And Frank learns, hey, when I'm home by myself, first of all, we got here really slowly, so I'm never really traumatized. And I get all of these treats. And so that's my one little hack. It's not always that easy. It's not always super smooth sailing, but I think it can really help. I've had a couple of questions about dogs barking at TVs, barking at bears and horses. And I think one of the things we were just talking about is that our new TVs have a refresh rate that works for a dog's eye, where those of us that are old enough to remember the CRTVs, their refresh rate was fast enough for ours, but slow enough that Fido was watching like the flick picture show, like So probably they weren't really checking out what we were checking out, whereas now they are, and they're like, that's a horse, that's a bear. I would approach the problem in the same way as I would with Frank and the other dog. The cool thing about that is, in some instances, we can tease apart sight versus sound. And if it's both, we can work on one at a time. We have that beautiful ability where we can turn on the TV, and have the audio. And if we can't black out the TV, I'll throw a towel over the TV and just work on the audio to start with. And by work on it, try to create a threshold, find a way to manage. If distance alone is not enough, what I often find is popping them on a lead, warming up, so we're walking around the house feeling like fools. Rapid fire treats, tennis ball, tug, whatever works. We get in a bit of behavioral momentum where Frank's like, this is great. I don't know what we're doing, but we're walking around the lounge room and I'm having a good time. And then we turn on the TV, and from a distance, from as far away as I can, Frank sees the horse. And the second he sees it, and this is the important part of the timing, when we're looking at the white dog and the grey dog, I'm watching Frank, and the moment Frank sees that horse on the TV, I'm there. And so I say, and I said to you, I told him when I call his name, he looks to me. So I say, yeah, Frank. And if he looks, well, if he doesn't look, we're too close. And I need to manage that further. I need to dissipate that trigger even further. But if I can have him as far away in that room, even I'm down the hallway looking, I've got him on a lead, I've been rapid firing treats, here comes the horse, he sees it, and by sees it, I'm watching him and he goes, carpet, couch, horse. And you see him, he goes, whoa. And his ears, he's a Dachshund, so his ears aren't doing this, but they're doing this. And then I go, yeah, Frank. And he goes, whoa. And I'm like, go, let's get out of here. And we duck into the bedroom and I turn the TV off. That's one rep. And for Frank, that's fun. He's like, cool, we just did a thing. I got a treat. This is pretty cool. And when I saw a horse, I did a thing with Dad and I got snacks and it was pretty fun. And if we do that, and I said before 300 times, which I know is daunting, sometimes it's like 10. And sometimes it's like 300. But eventually he builds that conditioning that he goes, cool, see the horse, play with Dad, food in my belly, this is not so bad. So that's how I would approach those things. The hard part is sometimes managing that trigger gradient. And that truly, in a house, we can't get 50 meters away. But I would be playing around with, is it better on a lead? Is it even better in an arm? Does that just change the context? It's not that we want them to think, oh, I'm not allowed to do something. Does it just change the context? So I then go, horse. And you can go, yeah. As opposed to, this is what I've done 200 times before. So I'm just going to do it again, right? We just want to change it up so that they offer something different. What have I got? 4 minutes. Let's knock through some fun ones. Non-sexual humping. Saving the big guns for last. I think of humping as a displacement behavior, meaning that it's a normal doggy behavior displayed out of context, normally due to excessive emotional arousal. It can be positive or negative valence. So I think often enough we see these dogs having a good time, getting super excited, probably getting a little too excited, and not knowing what to do with it and thinking, I need to get this out. What am I going to do? And displacement behaviors include scratching for a dog that's not itchy, has never been itchy, or shaking when it's not wet. They're out of context and they're made to dissipate arousal and stress. Like us, that kind of vibe. And so I would be thinking in those dogs about the relaxation technique, starting that away in your yoga studio so that we can be nice and zen, and then gradually, once they're good, bringing it back and teaching them you can do something a bit exciting, and then you come back to me and we chill out for a minute. And then we can do something exciting, and then you come back to me and we chill out for a minute. And the beauty of that is not only do we teach them to relax, but we teach them to self-regulate. We teach them that they can self-regulate. They don't always do it, but they learn that they have that ability to go up and down. Because it should be, emotions and arousal should be like a roller coaster, right? It would be no fun if we were always super pumped or if we were always super flat. It's about the ups and downs.
Sorry, I stuck. The hunting net, and you said you be some mad, so we be some mad method. Is you start to hunt some mad.
Okay. Uh-huh. So then so that relaxation method is not about the mat. The mat can come in and be part of the environmental cue that that's what we're going to do. But in that setting, that mat only comes out for that. And I would only start using the mat once I knew that that relaxation was working. So if they're at that point, and now don't get me wrong, we had no dog beds for a while because Andy would have his way with all of them. But I think if we're there, we're still too high and we need to teach him to come down. Cool. That mat doesn't stay down. I'll talk to you in a bit. Yeah. That for me is then another chance. The mat's gone. We grab him and we go, cool, come sit down with me. We're going to chill out. Yep. I really appreciate all of your time. Thanks for having me. Thanks for being here and interested in doggos.
Everybody give Rich a round of applause.